Hi there, Laura Dankoff here from Path to Health and Healing and the founder of the Hormone Health for Women's Facebook group and the Path to Hormone Health membership tribe. Today I want to talk to you about a silent problem that many women are dealing with, and that's vaginal dryness. Before we get into that, however, I have to give my loving disclaimer that the information I'm going to share with you is for educational and information purposes only and is not a replacement for seeking appropriate medical care. So vaginal dryness, don't suffer in silence. Vaginal dryness affects many women. As many as 50 to 70% of women will experience vaginal dryness at some point in time in their life. Women between 18 to 50 may, up to 17% of these women may experience vaginal dryness, and after menopause, up to the 50 to 70% of women can experience vaginal dryness as well. So despite this high number of women experiencing problems related to vaginal dryness, it's still, like I said, a very silent problem that women feel too embarrassed to talk to their partners, their friends, their healthcare providers about, and so they don't seek help, they don't seek advice. And this does not have to be inevitable, that this is something you just have to learn to live with when you get older. I mean, there are things that can be done. So how do you know if you're experiencing vaginal dryness? So let me ask you, do you experience pain, irritation, dryness, or burning during intercourse? Do you experiencing bleeding or spotting during or after sex? And when you go in for a pap smear, has it been more difficult and extremely uncomfortable? And lastly, has the appearance of the vagina or the outside wall of the vaginal area, the lips on the outside, this is known as the vulva, have you seen thinning of that occurring? So all those can be signs of vaginal dryness, and we're going to talk more about what's going on, what symptoms you may be having, what to ask your healthcare provider, and also what are some treatment options as well. So in order to keep that vagina nice and moist and supple, we have natural lubrication that occurs in the vaginal vault itself. And this does a very important job keeping the area clean, decreasing your risk of infection and disease. It removes, dead cells or tissue from the area. All of this is very important. So this can sometimes be a challenge when this dryness is occurring. And then during sexual excitement, the Bartholin glands, which are two glands at the entrance of the vaginas, that produces extra moisture to aid with sexual intercourse as well. Now, we know that changes in the hormone levels, such as a decrease in estrogen, may be one of the culprits that's contributing to this vaginal dryness. But there are other factors that can also be occurring outside of this that may be contributing to the vaginal dryness and discomfort. This includes decreased libido, and so if you're not sexually aroused, those Bartholin glands, aren't releasing that lubricant. So naturally, you may be part of the reason you may not have an interest in sex or decreased libido is because we women think in our heads a lot. And if we're stressed out, there's a lot going on in our lives, we're busy, it's hard to relax. If there's friction with your partner, if you got things going on with kids or work, trying to shut that all down to be receptive to foreplay and intercourse with your partner can be more difficult. Other reasons may include, medications such as over-the-counter cold medicines, antihistamines, antidepressants. Have you had chemotherapy? Have you recently had a surgical hysterectomy? And that's impacted the hormones, pretty sharply right away. Are you using drying soaps? Do you swim in a pool with chlorine or, pool chemicals, or a hot tub? These are all things that can be contributing to vaginal irritation and dryness as well. Now, after menopause, or if you've had a surgical menopause, one of the things that I mentioned that can be causing that discomfort and dryness and thinning of that tissue, can make it raw and irritated sometimes, is the lack of estrogen. Estrogen helps keep that tissue supple and moist. It helps with the moisture and the pliability, so the vagina isn't so stiff. When you have decreased estrogens, that becomes less pliable, less elastic. So symptoms that you may experience are loss of lubrication during sex, making more painful sex, thinning of the skin around the vagina, which makes it more easily damaged, because you don't have that lubrication there, and that friction and irritation can cause pain and discomfort as well. And when you're experiencing that, your interest in sex kind of goes down, because all you're anticipating is pain. And that's why it's important to be evaluated and discuss this with your partner. You may find that, maybe you didn't know you had it, and you went in for a pap smear, and all of a sudden or before it hadn't been painful or difficult, and now it is. And another symptom is that you'll notice a change in appearance of the vagina and the vulva occurring, and this thinning of the tissue, and changes in vaginal discharge. Now, there's an emotional impact from all this. It can affect your self-worth, your self-confidence in yourself. You're going to feel confused and frustrated. You may feel embarrassed, and I don't want you to suffer in silence. That's why I'm here talking to you about this now. It's important that you don't suffer in silence. You get things evaluated. You talk to your partner, and the first thing is recognizing that problem is there, that it's normal, a part of aging, if you will, but we also want to make sure there isn't something else going on. So first thing is go and be evaluated by your healthcare provider. And what I would suggest here is prepare for that visit. You know that your time with them is very limited, and so you want to get the most out of your visit as possible. If you're uncomfortable bringing up the subject with your healthcare provider, write a list, hand them the list, and say, here's my concern. Put it by priority. Tell them when your symptoms began, how long it's been going on, has there been any changes in your life, whether stress, medication, have you had recent chemotherapy, are you just going into menopause? What are some of the symptoms that led up to when you started noticing the problem? When you're asking these questions, sometimes we get overwhelmed, and your provider may spew off, well, we're going to do a pelvic exam, we're going to get this blood work, and we're going to do XYZ, and here's some treatment options. Well, that's a lot of information in a short period of time, and sometimes we forget what we're being told. So it's not a bad idea to take an advocate in with you, such as your partner or a friend, that can be there writing down what the healthcare provider is telling you, or also you could have your list of questions to have them speak up on your behalf if you're afraid. And then if you don't want them in the room during the pelvic exam, they can leave during that part of it. But sometimes it's helpful to have somebody there with you to, write down, the information. And then don't wait and hope that the healthcare provider is going to bring that up during your routine exam, because there's probably a good chance they won't. You have to bring it up. And if you don't bring it up, then you maybe go another year, 2 or 3, 4, just suffering in silence, saying, well, I didn't bring it up then, I guess I'll just have to live with it. No, you don't have to live with it. I want you to bring this up with your provider. Let them know it's a concern for you and that it's impacting your quality of life. And then let's say, okay, you've had the physical exam, you've had the pelvic exam, maybe had some blood work done, and you're told everything's normal, but yet you've still got this vaginal dryness thing going on. So what are your options? Well, in some cases, there are some prescription options, and there's also non-prescription options, and it all is dependent on your particular situation, and what options you're comfortable with and that are appropriate in your case. So there are localized excuse me, estrogens that can be used that are great, just right to the vaginal tissue. It can help keep that tissue healthier, more pliable, and more receptive to sexual activity, but also to help with any irritation that you may be experiencing. It also can lessen your chances of, decrease your risk of certain infections in the vaginal area, whether that be bacterial vaginosis, yeast infections, even getting urinary tract infections. There was a study done years ago in a nursing home. I don't recall the study now. It was a small study where the women in the nursing home were getting urinary tract infections, and they started using vaginal estrogen with them and found that the incidence of urinary tract infections decreased. But there are different types of estrogen that are used. There's estradiol that goes to a regular pharmacy. There's estriol that goes to a compounding pharmacy. So those are some of the vaginal cream, gel, tablet options that can be inserted in the vagina to help with localized with that tissue, and they do have minimal risk, really. Another prescription option is Ospina, which is a tablet, oral. That's certainly an option. As a functional medicine practitioner, it's not going to be my first option. I'd rather do the more natural, safer options, if at all possible, that have been found to be useful. One of my favorites is Julva DHEA cream. This was developed by a gynecologist, and I will put a link to that below this video for you, so that you can check that out as well. Another compounding options include testosterone and oxytocin. Those can help with sensation, libido, and with the tissue moisture itself. That's an option. You want to avoid, whenever possible, drying things. Like I mentioned, hot tubs and pool chemicals, perfumes, lotions. Please do not use powders. We know there's some risk around using any kind of powders. These are all very drying, antihistamines. And then there are natural lubricant options as well, particularly for women that maybe any kind of hormone replacement or estrogen, for example, isn't an option for them. So some natural lubricants, and preferably organic as possible, include coconut oil, vitamin E oil, sweet almond oil, grapeseed oil, sunflower oil, or some of the commercial lubricants and moisturizers out there, such as KY Jelly, Replens, Vagisil, and Astroglide. So you want to, take some time to evaluate your options. You don't have to suffer in silence. You don't have to accept that this is just a normal part of aging. There are actually things that can be done, and just with the few treatment options that I mentioned, there are things that can help. Now, you may have to do some trial and error to figure out which works well for you. Some of these are by prescription only. But first and foremost, consult your healthcare practitioner. So in summary, we know vaginal dryness is very common, and many women suffer from it, and there are things that can be done. You don't have to suffer in silence with this kind of pain and discomfort and feeling embarrassed about it. Your healthcare provider is very they may be adverse to dealing with hormones, because a lot of them don't want to, focus on hormone health, but they know some very easy things to try to help with the vaginal dryness. And if you aren't getting answers there, seek out the help of another healthcare provider, or someone versed in women's health. whether that be your gynecologist, a functional practitioner like myself, or others. So I hope this helps, and I would love it if you would like, share this video with, and subscribe. I, and because there's lots of women out there that could really use this information. And as I said, I will put the link for Julva below, and along with additional resources. So I hope you enjoyed this, and feel free to comment below. Take care.